So first, let me introduce you to our morning keynote, Understanding Lesbian, Bisexual and Queer Women's Experiences of Alcohol, Substance Use and Health, the Unleash online cohort, by Sonja Memedovic and Julie Mooney-Somers. This project explores lesbian, bisexual and queer women's health and well-being and relationship with smoking, drinking and drug use. Dr. Sonja Memedovic is a postdoctoral research fellow at the National Drug and Alcohol Research Centre, UNSW, Sydney. Her research focuses on the relationship between substance use disorders and other mental health conditions among at-risk populations, with a particular interest in the identification of modifiable risk and protective factors for these disorders. Associate Professor Julie Mooney-Somers is a social scientist with a track record in research on the health of sexuality and gender diverse people, primarily relating to tobacco, alcohol and other substance use, and sexual and reproductive health. Julie is part of the team that runs SWASH, the longest-running periodic survey of LBQ women's health and well-being in the world, and of Unleash, a cohort study of LBQ women and substance use. She is an associate professor at Sydney Health Ethics School of Public Health, University of Sydney, and an associate professor at Sydney Health Ethics, University of Sydney. Now, we're going to hear a wonderful keynote from Unleash, Understanding Lesbian, Bisexual and Queer Women's Experiences of Alcohol, Substance Use and Health, the Unleash online cohort.
I acknowledge the Gadigal people of the Eora Nation, the traditional custodians of the unceded land on which I work and research. I pay my respects to elders past and present and those attending the conference. I'm going to give you a quick overview of what we know about LGBTQ women and substance use, and then I'll hand you over to my colleague Sonja for a deep dive into the Unleash project. While several national and state strategies recognise that substance use harms are not experienced uniformly across the population, and some name LGBTIQ people as a priority population, it's pretty rare to see LGBTQ women specifically mentioned or indeed visible in public health campaigns or health service promotion. So what do we know and what is the sector doing? I'll start with smoking. In 2020, 18% of SWASH respondents were current tobacco smokers. That's a dramatic drop from the 30% we saw in 2016, and an even more dramatic drop if you go back a decade. In 2019, Private Lives found 17% of LBQ women in that national sample were current smokers. That's pretty consistent data, but still higher than the 13% of women we find in the general population. In 2013, the National Drug Strategy Household Survey showed that LGB women smoked at around twice the rate of heterosexual women. So while there's a long-standing disparity between heterosexual and LGBTQ women, it looks like that gap is narrowing, and that's really great news. Most current smokers will say that they would like to quit or reduce their current level, and the response to this need for support has come via some important partnerships. ACON and the Cancer Institute of New South Wales came together several years ago and developed the Smoke Free Still Fierce campaign, which is absolutely, definitely worth Googling for the video alone. And I know a new campaign is coming. Thorne Harbour Health and Quit Victoria have been working together on a range of programs, including training all of the staff on the Quit line, which is amazing. They've also worked with other community organisations in Victoria and the Queer Film Festival to run a film competition, and the image on the slide is from one of the winners. Let's look at alcohol. From SWASH 2020, we know that 86% reported drinking alcohol, but unlike smoking, we have seen very little change over time. National and international studies show that gay and bisexual men's patterns of alcohol use look similar to heterosexual men, but LGBTQ women's patterns of alcohol use look very different to heterosexual women. They're more likely to drink, more likely to report high-risk consumption, more likely to report daily drinking, and more likely to start drinking at a younger age. The gendered pattern that we've been led to expect for alcohol, so differences between men and women, changes when you add sexuality. And that means that we all need to be paying better attention. From SWASH and Private Lives, it looks like about 1 in 5 women have been concerned about their alcohol use in the past 12 months, yet very few of them seek support. What causes women to move from being relaxed to feeling concerned? And what prompts women to then go and seek support? We know from the ALICE study, and a shout out here to Ruth McNair, Rhonda Brown, and Amy Penney for their work, that a quarter of their participants were concerned about their alcohol use over the past year. And despite high rates of heavy drinking, which may be indicative of harm, very few women had sought support specifically for alcohol. And if they did, it was more likely to have been through a mental health service or a GP than an alcohol specific service. We know from other research that LGBTQ women are not necessarily seeking support from substance use services. But why is this? And are mental health and GP services just as effective? Finally, let's look at illicit drug use. From SWOSH 2020, we know that in the preceding 6 months, just over half had used any illicit drug, and that's a significant increase on 2018. And half of those reported using multiple drugs. Now, this is pre-COVID and was just at the height of the Mardi Gras season. But 20 years ago, the longitudinal study of women's health showed us major differences in rates of illicit drug use between heterosexual and LGBT young women. The more recent National Drug Strategy Household Survey shows that LGBT women are nearly 3 times as likely to report illicit drug use in the last 12 months. This pattern is repeatedly found in international research. And this is actually quite similar to what we see in relation to alcohol. Gender and sexuality coming together, we're seeing something quite particular. But of course, use does not constitute a problem, and even high use doesn't necessarily mean a problem. However, we do know from SWOSH that 1 in 10 women who recently used drugs had felt concerned about their use, but very few of them had sought support. There really is a serious lack of research on how LGBTQ women are experiencing their substance use. We need to understand the contexts of use, the meaning of use for individuals, and when it becomes harmful. So let's have a look at what the sector is doing. I've already mentioned some partnerships, and I want to add to this ACON and NADA, who've also worked with South Sydney PHN, who've worked together for several years to develop inclusive guidelines for AOD treatment providers working with LGBTIQ people, as well as a whole range of training resources and advocacy to have data collection by treatment providers so that we can track treatment outcomes for LGBTQI people. ACON and Thorne Harbour Health have developed and run their own tailored substance support services. And again, we see an important partnership here. Thorne Harbour Health developed drink limits for LGBTQ women concerned about their alcohol use, and ACON has now taken that program to Sydney. The conference theme is Our Health Matters. So the relative invisibility of LGBTQ women's substance use needs to change. We need to understand how and why women use tobacco, alcohol, and illicit drugs, when and why substance use becomes a problem, and perhaps as important, what prevents it from becoming a problem, because for so many people, the use isn't a problem, and what support women want to benefit from. I'm going to hand over to Sonja now, who will talk about a research project designed to answer some of these important questions.
Thank you, Julie, for that context. I'm coming to you from Camaragalland, and I will take you through a bit of a detailed look at a new project that we got off the ground earlier this year called the Understanding Lesbian, Bisexual and Queer Women's Experiences of Alcohol, Substance Use and Health, the Unleash online cohort. Now, this is the first time that we're presenting on Unleash, and we're really excited to share with you our first look at some preliminary findings from our baseline survey. The aims of Unleash are to better understand among LBQ women in Australia the patterns and context of substance use and associated harms, risk and protective factors for use, related health conditions, and healthcare access and satisfaction. Before we have a look at some of the findings, I'd like to tell you a little bit about some key elements of the Unleash development and implementation process. Now, early on in project planning, we established an expert advisory panel, which is our national advisory group comprising experts from the LGBTQ community and community health organisations, senior research and clinical advisors working within the LGBTQ community, and the project's chief investigators. Now, in addition to providing advice on substance use and mental health research, our EAP ensures that the project represents the diversity within LBQ women, is relevant and responsive to local community needs across jurisdictions, that it's well informed on key issues, incorporates community perspectives, including through lived experience, is aware of recent clinical policy or legislative changes, and that it's employing appropriate and sound research methods. So what does Unleash look like? Now, it is a national online longitudinal study. We made it a national study because a lot of the existing knowledge in LBQ women's substance use tends to be Sydney or Melbourne centric. And with this being an online study, we really had an opportunity to understand experiences across the country. To ensure that we had broad geographical reach, we put a lot of thought into our participant recruitment strategy with guidance and assistance from our EAP. This included thoughtfully targeted Facebook ads, as well as promotion of the study through our national network of stakeholders. We had some really exciting shares on Facebook, including from SBS Pride. Our current funding allows us to conduct 3 surveys over a 12-month period. Now, as Julie has mentioned, there is a gap in understanding how LBQ women's substance use and factors that impact it change over time. A longitudinal study will allow us to unpack this in a way that single time point snapshots can't. So what are we asking about? There are questions on demographics, tobacco, alcohol, and other drug use patterns and behaviors, general and mental health and well-being, experiences of discrimination and stigma due to being LBQ, intimate relationships and any experience of intimate partner violence, health service access and use, community and social connection, and we're also asking for participants on feedback on key elements of our process. To take part, you needed to be age 16 or older, identify as lesbian, bisexual, queer, or another non-heterosexual identity, for example, pansexual, identify as a woman, cisgender or transgender, and be currently living in Australia. But you did not need to be using or to have a history of using substances. I'll say a little bit more about this later on. So where are we at? Our baseline data collection ran from mid-June to mid-September, and it is now complete. We recruited nearly 1,200 women, and we had 890 usable surveys for the data that I am presenting on today. Our 3-month follow-up is currently underway. Okay, let's get into some of the hot off the press findings from our baseline survey. So as I mentioned earlier, this is the first time that we're reporting on Unleashed data. So it is important to acknowledge that what I'm presenting here is preliminary and it has not yet undergone peer review. So please keep this in mind. Okay, so who have we heard from? As you can see, about 50% of our cohort identify as lesbian or gay, with about 1 in 5 identifying as bisexual, about 1 in 6 identifying as queer, and 1 in 13 identifying as pansexual. In terms of gender identity, 93% of our cohort identified as women, 4.5% as non-binary, and 2.5% used another term to describe their gender. Unleash is a study for women, so respondents who did not select women were asked an additional question and only included if they indicated that they experienced a connection to the term woman. 11% of the cohort are trans and gender diverse, with almost equal proportions reporting they were assigned female at birth as were assigned male. In terms of where our participants come from, we have a good spread across jurisdictions, which actually quite closely reflects Australian population data, with expected overrepresentation of the ACT and the NT, which Julie tells me is because of the army and the public service. Over a third of our cohort comes from outside of capital cities, and we're really pleased about this. We want a good diversity of experiences represented in Unleash. In terms of other demographic characteristics, the average age of our participants was 35, and this is really similar to the average age in the periodic SWASH study of LBQ women and to Private Lives, a recent national survey of LGBTIQ people. Under 3% reported that they're Aboriginal and Torres Strait Islander, and this is similar to the general population and to Private Lives. The vast majority, 85%, were born in Australia, and this is significantly higher than in the Australian population, where it is around 70%. Again, though, the proportion is similar to Private Lives, which was 84%. The majority of our cohort are university educated and employed, similar to what we see in SWASH. 2/3 were in an intimate relationship. Of these, 64% were in a relationship with a trans or cis woman, 25% with a trans or cis man, and 6.5% with a non-binary person. Okay, I will now give you an overview of some key indicators of substance use. At this point, it's really important to note that even though women could participate, even if they had never used substances, given that our recruitment materials made reference to substance use, we've certainly oversampled women with current and past substance use involvement. So I just really want to emphasize that these findings should not be taken as representative of substance use among all LBQ women. Okay, in terms of last use of substances, a third have never used tobacco, a third have used in the past year, in the brackets here, and a third have used more than a year ago, so they will be classified as ex-smokers. Now, it's hard to make direct comparisons to other surveys where questions are asked differently, but smoking does look to be higher in Unleash than in Swash and Private Lives, where current smokers were 18% and 17% respectively. The vast majority had never used e-cigarettes or vaped, but about 1 in 5 had within the past year, and this is broadly comparable with Swash 2020. What I really want to highlight from this slide, though, is the ubiquitous nature of alcohol use in our cohort. The vast majority reported drinking in the past year, so over 90%, as you can see here. Only 2% said that they had never used alcohol. The never used alcohol figure is much lower than the general population. In the 2019 National Drug Strategy Household Survey, 16% of women said that they had never consumed a full glass of alcohol. We did find a similar proportion who could be classed as ex-drinkers, so people who have drunk alcohol previously, but not in the past year. The general population rate from the NDSHS is nearly 10%, and in Unleash it is 7%. We asked people to what extent they agree with the statement, regular use of a substance is normal in my group of friends or in the LGBTQ community. Now, look at the contrast here. The vast majority agreed or strongly agreed that alcohol use, so in the maroon, was normal, and less than 10% disagreed. While women were much more likely to disagree than to agree that smoking, which is in the pink, is normal. We also asked to what extent people approved or disapproved of cigarette smoking and alcohol use. In relation to alcohol use, so again in the maroon, the majority neither approve nor disapprove. And one way that we could interpret this is that alcohol use is so normal that respondents barely have an opinion on its use. This contrasts with a strong position towards smoking. So again, in the pink, where close to 60% said that they disapprove or strongly disapprove. There has been a major shift in smoking among LBQ women. Less than a decade ago, Swash was showing that almost half of young LBQ women were smoking, with older women not far behind, while other research showed that smoking was perceived to be simply a part of being a queer woman. And yet, even among the Unleashed cohort, where we expect substance use to be higher because of how we recruited and advertised the study, smoking is not seen as normal or acceptable. In terms of use of illicit drugs, just under 1 in 5 reported never having used an illicit substance in their lifetime. Lifetime use of cannabis was the most common, with nearly 80% of our cohort reporting use at some point in their lifetime. Nearly half have used MDMA in their lifetime, and just under 40% have used cocaine. And these top 3 drugs are the same as found in the recent Swash 2020 survey. Now, again, a really important reminder that this data cannot be taken to be representative of substance use among all LBQ women. In terms of more recent use, so in the past 12 months, about a third have used cannabis and more than 1 in 10 have used cocaine and MDMA. A reminder though, this data relates to a time frame when significant proportions of the cohort experienced lockdowns, when access to illicit drugs may have been restricted, and in many jurisdictions, venues where people might normally use some substances were closed for some or much of the past 12 months. We see a nuanced pattern around how respondents perceive the use of specific illicit substances. So regular use of methamphetamine, LSD, and cocaine were generally perceived to not be normal among friends and the community. For MDMA, roughly similar proportions agreed that it was normal as disagreed. For cannabis, though, in the maroon, almost half perceived its use to be normal, 20% neither agreed nor disagreed, and around 20% disagreed. Things were more stark when it came to approval. So 30% approved and 50% were non-committal around whether cannabis in the maroon was acceptable. That is, cannabis is a really commonly used drug, and its use is perceived to be largely normal and acceptable among the unleashed cohort. For other substances, approval was consistently below 10%, and disapproval was high, from around 50% to around 80% for methamphetamines. Okay, so where to next? Our immediate focus is on using the baseline data that I've just given us a look at to explore substance use in more detail. So including looking at patterns of use, so for example, how much and how often are people using, and experiences of the positive and negative consequences of use. We've also collected data that will allow us to look at whether patterns of use can be considered risky for health. We will also want to look at the factors associated with substance use, experiences of stigma and discrimination, relationship experiences, mental health, sense of support and connection, and other demographic characteristics. At the moment, we're in the middle of the 3-month follow-up, and the 12-month survey will start in the middle of next year. Once we have that data, we can use it to explore the factors associated with changes in substance use. We're looking forward to examining data we collected on healthcare experiences and treatment seeking, as well as on positive and negative consequences of substance use. We've asked about COVID in the 3-month follow-up survey, and we're very interested to see respondents' experiences and perceptions. I want to give a special thank you to all the people who supported the development of this study, the chief and associated investigators, and the expert advisory panel, and the team who have worked with me to make the project happen. Joe Peneloric, Anna Barker, Mohamed Hwai, particularly want to thank for his help with the analyses presented here today, and of course, Julie Mooney-Somers. And finally, my gratitude to all of the people who shared their experiences in the first survey and who are now completing their first follow-up survey. We're excited and honored by your input. Thank you.